Good afternoon, and welcome to this afternoon's COVID-19 briefing. Today, the North Dakota Department of Health confirmed 26 additional cases of the novel coronavirus disease, or COVID-19. This is our highest number in a 24-hour period. 7 of those are from Cass County, 3 each from Burley and Ward, 2 each from Barnes, McLean, Morton, Montreal, and Stark counties, and 1 each from Divide, Mercer, and Sioux counties. Again, clarification, when we say they're from those counties, this is the address that the person listed at the time they took the testing. It does not mean that the individual who tested positive is currently residing in that county. They could be in another part of the state, but they are the point of that is less about whether that individual or not is in that county, but it's just to understand that with 26 new cases, the curve continues to climb. But let's take a look at completed tests in North Dakota. We can see where they are by county, and of course, appropriately, we've got more tests in our more populous counties. We had a good day of testing yesterday with 399 tests that were completed yesterday, so that's our second highest day of testing, but it's also the highest percentage of people that came back positive in a day. 16 of those have been hospitalized, and as we reported sadly yesterday, we've had one death. When we take a look at the curve of the new cases on the spread, again, this is the point that we've been talking about for some time, where we had very flat at the beginning. We had a little bit of a spike. We went flat again. We called those our days of reprieve. It now appears that we're on this climb upward that other states have seen in terms of increase in new cases. But in talking to other states and looking at other models that have been done, it's hard to see exactly whether you can be fully confident in new test cases data until you get beyond the 100 cases level for a state. So we're still in a position where things may be jumping around a little bit, but I think you can see they're going up. When we take a look at the slide that includes, in this case, the blue underneath is the cumulative number and the yellow is the new cases per day, you can see again this as we continue to climb upwards. And so this is two things. This is the data that we're looking at. As we said before, the data that you're seeing here in the key takeaways is that this data is latent. An individual that may have contracted this 10 days or more ago, they have a few days of incubation, then they start to feel a little bit bad, but they're probably not bad enough they've ever said, hey, I would ever go see a doctor. And now, like, hey, now my symptoms are getting worse, I should go get tested. And then we've had a lag time in some cases of 1 to 2 days on testing, longer in the case with the stuff that's sent to the national lab. But then and then the test comes back positive. So it's latent. That is, if we've got the 26 new cases today, that's like saying that 26 people contracted this 10 days ago, and 10 days ago we were sitting in this room looking at numbers like 1 and 2 a day. The second way that this data is latent, meaning lagging, but it also underreports. There are some models that have been used internationally that have indicated that anywhere between 16 and 19 cases may exist relative to the people who've been tested. We don't have any way of confirming that, but let's just say in terms of our planning in North Dakota, we're assuming that there may be at least as many as 10 positive cases for every one that we turn up that shows up as a positive. And so again, this is 10 days late in terms of data, and it may be underreported, meaning there could be 10 times as many cases. So the way to think about that, if we've got 94 positive in the state right now, that would be 94 positive 10 days ago, and it might actually be closer to 1,000 people that have contracted it. That's the way that, at least from a planning standpoint, we're thinking about it here at the state. And so then what do you do if you think that you don't have 94 cases in your state, you think you've actually got 1,000? What you would do is you'd start doing two things. You'd keep educating everybody about steps to take to slow the spread. This is the part where, again, we can flatten the curve, if you will, of the capability. But those steps include, everything we've talked about: stay home and avoid non-essential travel. We've got some monitoring on interstates as part of our regular traffic, and traffic may be down 30%. That would assume that people think that 70% of what they're doing is essential, so we may want to redefine as North Dakotans what's essential or not. If you can, combine trips, shorten trips, have less contact with people when you're doing those trips. If anything you can do to reduce contact is a way to help slow the spread. So that's, and again, staying home is a recommendation that we're giving, and stay home includes stay home or be outside. It means keep physical distance away from other people. We still have the orders in place where we're making the strong recommendation about not holding or attending social gatherings, 10 or more people. Again, lots of businesses have moved towards work at home. Others, we have mandated their closing, but if you're sick, don't go to work. And if you're sick, don't go to work. Don't go to any gatherings if you're sick. And if you're sick, don't even go shopping. Have somebody else take care of that, because you could be someone who's spreading. If you are, and again, symptoms could even be mild, could be milder than what you might have stayed home for before. Under our culture of being North Dakota tough, but being North Dakota smart, is you've got to keep yourself at home, even if your symptoms are mild. And again, cancel or postpone all large gathering. And washing your hands is key. And we've said this over and over, but this could help protect you and protect others, and practice good hygiene. And again, remember, even if you're keeping distance from others, this virus can live on surfaces. So again, washing your hands after you've touched common surface, ATMs, gas nozzles at a gas station, the door handle going into a business or a mall or a hospital or clinic. Those are all places where if you've touched surfaces like that, you should be hand washing after that. So again, I want to say thank you to everybody that has been practicing this and been doing this for the last couple of weeks. Thanks to the business leaders, thanks to the team members, the employees, thanks to Team ND, thank you. If you haven't been practicing this, and now as you see 26 new cases today, with the likelihood that actually means there could be 1,000 cases already in North Dakota. If you haven't been practicing and taking this seriously, we ask you, on behalf of the 20% of North Dakotans who could find this to be not just vulnerable from this, but have risk of death from this very serious virus, we ask you to begin practicing these health practices if you've not. The second thing you do, because this is flattening the curve we've talked about, so I've just talked about the blue portion of this, which is how do we stop the spread? That's through both the restrictions we put in place, and then primarily it's through the individual responsibility, because whatever label you put on state mandated restrictions, it all comes down to whether or not people follow those or not. And again, we know that North Dakotans believe in and care about individual responsibility, and this is your chance to really demonstrate that. But the other thing which we can do is, again, as we're guiding, providing directions in terms of the physical distancing and the hygiene that will give us our best outcome in terms of fewest cases and fewest number of people that are critically ill, and therefore fewest number of people that may die from this virus. The flip side is we're also working super diligently, as we've said, everything we're talking about, what are we doing to try to raise our hospital capacity? And while we didn't issue any executive orders today, we've got 2 reports that we're going to give that we want to talk about here in a middle. But the first thing, before you start planning for that hospital surge, you've got to do begin doing some modeling. As we've talked about before, we want to be data-driven. There's models from all over the world. They are very wildly in terms of what they think their predictions are, and anybody that's been involved with analytics or statistical modeling would understand that those models are only as good as how accurate your assumptions are. So we've continued to pour more energy into this. We've assembled and are broadening our modeling team, which includes members from both the private sector and the public public sector and folks from the National Guard. We've got health officials involved in this. Last night, on Thursday, I had a call with other governors where one of the topics was modeling. Coming out of that, I got a reach out from Governor of Vermont, Phil Scott, who's another data-driven former business guy, doing great work there in Vermont. Vermont's similar to North Dakota in terms of, it's rural, it's older population, and it's one of the states that's on the bottom end of the populations of our 50 states. So we had a chance to talk to Governor Phil Scott last night, talk to one of his cabinet members today with our whole team, and we're using that input to help us continue to build out the models. There's tremendous uncertainty in this modeling, in anybody's model, and part of that is you have to make estimates around human behavior. Very hard to really understand what human behavior would be in. It's likely that if a place like New York, if someone is ignoring the orders that are given, and then because you don't know anybody that's sick, and suddenly you know someone who's sick, and then you know someone who's very sick, and then you know someone who dies, then you might start to take it more seriously. So there could be, again, a lagging effect of human nature before it becomes very real to them. We don't change the restrictions or the orders, but compliance may increase over time when people start to actually know somebody who has been affected by this. And so human behavior drives rate of spread. All these models have got a factor in there for rate of spread. There's nothing in these models about places like North Dakota, where if this is one of the last places in the United States for it to reach, will we take advantage of the extra time we had to learn and look what other states have done, and will we change our behavior accordingly? Or will we presume that, hey, because it isn't here yet, it's not going to come here, and then we'll continue to ignore orders that will, hasten if they ignore things that would, and do activities that would hasten the spread, or will we actually be smart enough to utilize our lead time to change the behavior? So tremendous uncertainty. So if you ask me about the two numbers I'm about ready to spit out, what's my level? I'll say very low confidence in the two numbers. But there's been some desire to have some estimates. And so we're at 100 cases today. When we look ahead, 94 cases today. When we look ahead about 3 weeks, the estimates in our models today would range from a 6x increase to a 13x increase, so that we're doing some planning that we might have 600 positive cases tested or 1,300 positive cases. Those are a range that we're looking in. It's possible we could come in under that if suddenly we become the most compliant state and are the most effective at all the guidance that we've given, or we could top that on the worst case scenario if if things change. And again, as I said at the outset, these models are dependent actually on more inputs. We've only got 94 inputs to put in there, so this is the earliest I've wanted to share any kind of estimates at all, and these models will get better over time. Every state that's further into their crisis, their modeling has gotten better, so we can learn from them. But what we can do when we're planning for hospital capacity is talk about two things. We can look at other countries and other states and know that if you have 80% of the people generally that don't require hospitalization, 20% do require hospitalization. Of those 20% that require hospitalization, about a quarter of them, or 5% of the total, would require some kind of intensive care treatment. And so that's where we're really putting our focus, because we got to make sure that that's where we could end up with a shortage. We could have plenty of beds, but if we don't have we need more than beds. We also need equipment, which means PPE and ventilators in particular, and we need staff, including trained staff. If we have enough beds, equipment, and staff to reach the worst case scenario peaks, then that's when we're going to actually save lives. As we've said before, that if you ICU with proper care with a ventilator, sometimes the mortality rate can drop to be less than 10% than those people that would not have those same support mechanisms. So we've got a great team of people working on this. Major General Alan Dohrmann, who's our Adjutant General, who also leads emergency service, is our emergency services for the state of North Dakota. As part of our unified command, we've got a team that's working on surge planning. He's going to come up and walk through some of the numbers of our Tier 1, Tier 2, Tier 3 hospital planning. General Dohrmann.
Thank you, Governor. I'll just start out by saying we've been actively planning on our surge hospital capability since earlier this week. Our partners on this are the U.S. Army Corps of Engineers, the university system, and our hospitals throughout the state of North Dakota that have some surge capacity. Some definitions up front, or some information. First of all, you're going to hear some big numbers here, but this is a pandemic. We haven't had one of these in a very long time. The governor's talked every day about the latent data. So when you hear these numbers, we are planning against the worst case scenario. And that's what we're planning toward, hoping that we don't need it. But right now, that's what we need to plan to, just because the uncertainty of a pandemic, the modeling piece, which when we spoke with Vermont today, they said, you know what, you got to get to 100 cases before the models really start to give some level of fidelity. So again, we're planning against the worst case scenario. Some background and terminology: North Dakota has 55 hospitals. That includes the State Hospital of Jamestown, the VA Hospital in Fargo, and 2 Indian Health Service hospitals in Bottineau and Newtown. Our hospital capacity varies greatly. Some hospitals are licensed up to 6 beds, some to 315. Each hospital can expand. Expansion, again, depends on available staff, equipment, and supplies. When we talk about expanding, hospitals right now would be considered operating at Tier 1 level. In North Dakota, at a Tier 1 level, we have licensed, or hospitals are licensed for 3,378 beds. Included in that are 183 intensive care beds. But at a Tier 1, because of probably staffing issues, we have the capacity right now to man and provide the equipment and the PPE required, 2,098 beds. So that's the Tier 1 capacity for our hospitals. At Tier 2, our hospitals are still in the lead. But in Tier 2, they can surge and add another 296 beds statewide. That would bring us up to a total of 2,394. With additional help from the state cash for medical resources, personal protective equipment, and personnel, that Tier 2 surge could go to 4,759 beds. Tier 3 is what we're focusing on right now. This is when the hospital-led solutions with state support in Tier 2 are potentially exhausted. Right now in Tier 3, we are planning to add additional 4,000 beds statewide. Right now, the focus on Tier 3 is building a facility or standing up facility in Bismarck and in Fargo. The Corps of Engineers will be in here early next week to start the assessment process to go through university system properties right now. The one thing we like about the university system is if you use an existing dormitory, the infrastructure is there for some of the other things you need, like food service, and the maintenance staff is already there. So that makes the most sense looking at those university facilities when we go to a Tier 3 surge. The one thing I want to mention too, ventilators get brought up a lot. As we've drilled down even deeper on where all the ventilators are, whether they're in an operating room, in an ICU, or in a cache. Right now, our total count for ventilators in the state of North Dakota is 408. And we are working very closely with our Department of Commerce. I can tell you daily conversations with the Department of Commerce, turning over every stone, shaking every tree, trying to find any available personal protective equipment or ventilators so that we have the resources we need at Tier 1, 2, and especially if we ever have to get to Tier 3. The other thing I would just like to, and this has been brought up before, but at Tier 3, personnel is going to become a challenge. And there are, retired healthcare or professionals or healthcare professionals that have maybe moved on to something else. We talked about this last week. Get in contact with your former employer if you're interested in coming in and being part of the team. If you have a skill and you don't know who to contact, call the Department of Emergency Services, and we will get you on a list with your skill set. If licenses need to be renewed or something needs to be waived on under one of the governor's executive orders, we'll get after that. But we need to collect a pool or form a pool of human resources so that as these new requirements come online, we're not scrambling to find the people, the equipment, or the personal protection equipment that the people need. So I think that's it. They made me go off a script this time because I said some words last time I probably shouldn't have. So with that, I'll turn it over to the governor.
Thank you, General Dohrmann. I want to reiterate something we've mentioned at other briefings, and this has to do about returning residents. So whether you're a college student coming back to North Dakota, if you're a traveler that's traveled in the United States or internationally, or if you're a snowbird that's coming back from Florida, Arizona, we are strongly encouraging returning residents to stay at home for 14 days after they arrive back in North Dakota, and then go on and fill out the travel survey online at health.nd.gov, and you'll receive information about what symptoms to watch for, how to self-isolate, and so on. And so again, trying to get that word out. If your neighbors moving back, from Arizona and Florida, we know some of those North Dakotans are watching these updates every day. We thank them for tuning in, but we want to make sure the word gets out. And again, if media can help on that, to make sure returning travelers to North Dakota requesting to self-isolate, and also to go on the travel survey, health.nd.gov, and put your information out there. The other day, we signed an executive order, which has been posted on our website, which cleared the way for action by the state health officer to help further prevent the spread of COVID-19. I invite State Health Officer Mylynn Tufte to explain that action, and then also talk about a new survey and a couple other topics. And she'll also go through all the geographies that are listed as areas where we'd want people to register from when they're returning. But here's our State Health Officer, Mylynn Tufte.
Thank you, Governor. In an effort to slow the spread, I signed a confinement order today requiring individuals traveling back to North Dakota from all international locations and states that have been classified as having widespread disease by the CDC. This order impacts individuals returning in the future and those who have returned within the past 14 days. The list of states can be found on our website at health.nd.gov/coronavirus, and look for the travel site. There are currently 23 states listed as having widespread community disease. It does not include our neighboring states of Minnesota, South Dakota, or Montana at this time. As an individual who's returning from travel or entering into North Dakota, immediately upon re-entry to the state, you must quarantine for a period of 14 days. We encourage individuals to fill out the travel form, as the governor said, on our website, so that you know how to monitor your symptoms. And if you have symptoms, we ask you to seek out medical care, but please call before you go in. I wanted to clarify something related to testing that has come up and we've heard about. We are asking our clinicians to continue to use their judgment to determine if a patient has signs or symptoms compatible with COVID-19, and then test individuals that are accordingly. Our testing guidelines stay the same and suggest that patients who have a fever or two of the following symptoms, such as respiratory illness with new or worsening onset, cough, shortness of breath, sore throat, chills, myalgia, which is those body aches, or fatigue. The governor mentioned talking about a couple of surveys, and he put the challenge to the Department of Health to increase our contact tracing tenfold. So in a first step to do that, we have put on our website a COVID-19 risk assessment. These are for people that are wanting to check their symptoms and understand what they should do. It'll tell you if you should seek immediate care and give you an opportunity to help us answer questions about individuals you may have been in close contact with. This will help us better understand specific symptoms and when they first begin. This will also help us with that contact tracing to identify who the close contacts are. This allows us to improve the process of contact tracing because we can compare an individual's response to the survey and what they say in the interview. Sometimes there's a lag between when you get a test result and the information that you might be able to provide at a more timely fashion. Please note that the contact tracing begins once the individual has tested positive. Not everyone who fills out the survey is going to get a call. So thanks again. The survey can be found on our website. And just a note about the dashboard. We recently improved it to be mobile friendly. There's a box that you can hit there, and then you'll see a trending curve and information about how many tests have been done per county. The dashboard gives individuals the ability to download data, and I want to say thank you to our web team for making that happen.
Thank you, Mylynn. And thanks to you and the entire team at the Department of Health who continues to work around the clock during this health emergency. School update. As you know, we restricted access to schools on March 15th to essential staff only. We redirected districts to develop age-appropriate distance learning plans. These were to be submitted by yesterday, March 27th, with implementation date of April 1, after the plan is approved by the governor in conjunction with the state superintendent. I'm pleased to report that every school district, all 175, met the deadline and has submitted a plan. So again, thank you to all those that have worked so hard in the past weeks to get those plans in. As of about 3:30 today, 47 of those had already been approved. Those approvals will continue to ramp up through tonight, tomorrow, and the weekend as we get through those plans. And again, deeply grateful to superintendents, principals, teachers, and other instructional, non-instructional staff for all the hard work in making it happen. And also want to thank all those folks, because many of the schools across our state have continued on with their nutritional mission, meaning they're either, making packed lunches and delivering them, or a pickup, or however they're doing it, but they're getting food out to thousands and thousands of kids every day during this crisis. To be clear, when we mean that we're resuming on April 1st, we are not reopening schools buildings. We're not reopening school buildings for student instruction until further notice. Students will be learning from home or in some other setting where they might be during the day. Access to schools is restricted to essential staff, except in the cases where some schools are or will be providing care during the day for kids in the K through 5th grade, K through 6th grade age, elementary school kids, where they're going to be taking care of healthcare workers and first responders if the traditional healthcare, childcare is not available. Next topic, unemployment count. These are numbers updated from the Job Service North Dakota. The full numbers for Friday, we reported them through 3 o'clock yesterday. The full number for Friday ended up at 2,473. So that was the highest day since the prior Friday. Second highest day since we've been doing the counts over the last 10 days, or 17,972 claims have been filed. And again, everyone's situation is different. But if you've got questions, please go to jobs.nd.com or call the Unemployment Insurance Benefits Automated Phone System at 701-328-4995. Before we go to Q&A, again, want to just, again, remind everyone to try to get their information from trusted sites, and one where we're funneling all information through is ndresponse.gov, and you see that I think up on a slide coming up, which is the all the kinds of information that are up there, and of course also the health department directly, and for jobs, jobsnd.com. With that, we'll post for questions. Dave Thompson.
Governor, I've heard some businesses ask, is North Dakota going to have a link from one of its websites to the federal programs, for example, SBA loans that are bridge loans, things like that?
Question was, will North Dakota have links to the federal stuff? And I would guess the answer is yes, because a number of those federal programs will be administered through, I mean, if it's changes to nutrition, changes to unemployment, and changes to healthcare, we'll try to keep updating all that. I would say that we will have an update on Monday at 4 o'clock at our regular press briefing. We've invited the members of our national congressional delegation, Senators Hoeven, Senators Kramer, and Congressman Armstrong to be here. We have one confirmation so far. Senator Hoeven is going to be back in town, so we'll have an opportunity to share more details on the historic federal legislation on Monday. Amy from the Bismarck Tribune.
Yeah, this would be a question either for you or for Mylynn. A nursing home in Mandan just confirmed to me that one of its residents has tested positive. Is that anything that you can speak to, and what sort of guidance and communication the state has had with them?
The question was, is there any guidance? We have had a team that's been ready to go should we get to this position of having a confirmed case in a long-term care facility. But as you know, again, the information that we get at the state that we're reporting to all of you is gender, age, and the county in which they live in, and whether they, not the county they live in, the county in which the address at which they put on their test. That's what we have. So it is up to each facility to do the notifications to their residents and the families of those residents when they have a positive case. And I hope as part of that positive case, they'll be including information about when the person may have contracted it and whether or not they're still contagious, because they're in North Dakota. Long-term care facilities are used as step-down facilities. So when people are leaving the hospital, so we may have going forward people who were positive, were hospitalized, have recovered, no longer contagious, and then they end up going to a facility. So it's important that we understand testing positive and contagious, two things, because if they're still positive, we would be wanting to get them out of that facility and into an isolation area quickly. We don't want people who are contagious to be in our long-term care facilities.
Governor, how is the new confinement order enforceable?
The question is the power that Mylynn has as state health officer. Well, as it is with other things, again, the enforceability here can be local or state or county health officers or law enforcement, and all of these things that we're putting out are infractions and punishable by fines up to $1,000. Lane?
Businesses that are still open, such as grocery stores and department stores, typically don't have restrictions, or not, at least not enforcing them, on groups of 10 or more people being inside their stores. Is there any potential contribution from those of the rising cases, and is there any advice to those stores to potentially limit people?
Question is about stores that might have more than 10 people in the store and how that relates to the gatherings. The key here is in any business that's operating like this, is going to want to adopt new operating procedures, just like that we put out guidance for childcare statewide. And those might be, maintaining, distances in a checkout line at a supermarket. Maybe there's increased spacing that goes on. Maybe there are limits. I know that many businesses have now doing what they call senior hours, where people that might be over age 65 have an opportunity to shop in a less crowded environment for certain hours. And if you're, under 65, you're not allowed to come in during that time. So we appreciate all of the folks that are adopting what would be new standard operating procedures. I know that, businesses, retail businesses that might have had sold food items inside there, they've shut some of those down. I know, some like sporting goods stores that also had, food, they're making modifications to doing that. But we know that people still need to have access to food. Got to keep our supermarkets open, but when you're there yourself, can again practice safe distancing to make sure that you're not there. We've also asked people to consider about again, whether in terms of their operating hours, sometimes it may be counterintuitive, but having longer operating hours, say for childcare versus shorter hours, may both support our emergency workers and also reduce the density in terms of the number of kids that are there at one time. And so part of modified operating procedures is anything that might reduce the density within that, and again, encourage all the innovation of the private sector to try to solve that. I see Mylynn is up here, is for possible addition or correction to my comments. Okay, is this an addition or a correction?
It's a correction.
Okay, it's a correction. Okay, wow. Okay, but good news. It's tougher than what I said. Okay, that's good news. It's not an infraction. Under this law enforcement, it's a Class B misdemeanor, which could result in 30 days imprisonment or up to a $1,500 fine. Thank you for that clarification.
A couple of questions, probably for Major General Dohrmann, about surge capacity.
And that was from Amy Sisk about surge capacity. And again, for our media that's present, yell towards these two microphones that are in front and everybody can pick you up. General.
I used to be in radio, I should know that. I had heard that, and you just alluded to this, that we're looking at potential university system facilities for surge capacity here in Bismarck. Would that be Bismarck State College?
Likely, yes.
Fargo, would that be NDSU?
Yes. And we've looked at all the college campuses. Again, we want to build and be there at time of need. So right now we're taking that approach, but we'll assess those other facilities. So again, we are planning against the worst case scenario. So there's a better chance we'll need some surge capability, and we're building to that right now. But we're continuing to work with Commerce and all others so that if that worst day in North Dakota were to happen, that we have that surge capacity, we have the people to man it, and we have the equipment that's needed and the personal protective items that those workers need to stay safe.
Got it. And then do you know if it ever comes to that day where we do need this, how quickly a facility could be up and running?
I really don't know. That's why we have the Corps coming in here next week, so we can get an assessment of what it will take to convert those facilities. There's also a lot of capacity within the National Guard. We have a lot of engineers. We have some architects on staff. So there is some additional capability there beyond the Corps of Engineers. But the Corps of Engineers has been given the mission assignment from FEMA. We were in contact with them last week. We have a liaison that's been in our operating center now for 2 or 3 days. The team is being built to come into North Dakota next week. So we should have a better idea of the amount of time and money that it'll take to bring these facilities online. Sorry.
Just one last question about that. Do you know what sort of patients would potentially be served at one of those facilities? Would they be patients that are maybe recovering, or patients that just need treatment for the coronavirus, or other patients that don't have the coronavirus but just need regular medical attention?
I'd say yes. and really, we have to work with the Tier 1 and 2 facilities and hospitals. And then as that curve bends up, if it does, what makes the most sense, and in some cases it might be on a regional basis. Now, right now, our assumptions are that patients who need a lower level of medical care, but maybe COVID, and be infected with COVID, that they may be the ones that end up at these facilities. As the governor said, as far as long-term care, maybe these are step-down facilities. But the idea, of course, being that those hospitals with the right kind of rooms, the right kind of personnel, and the right kind of equipment can give the best possible care to those that need it the most.
Got one for you, if you would. What does the contingency plan look like if there's an outbreak in a rural community, a fast spread in a rural community that's not really close to Bismarck or Fargo?
Well, again, I guess everybody can hear the questions now. Did we establish that? Okay. We're looking across the state of North Dakota, and the idea being to provide the care at the place that it's needed. So we look again at the Tier 1 and Tier 2 capability within that region. We'll build the plan to surge in that region so that we can cut down on the transport time, because that'll be critically important, especially if we're in that Tier 3, because every time we transport a patient, A, it could be stressful on the patient, and B, it could put EMS workers at risk of contracting COVID, and we need to keep our first responders, our healthcare professionals, we need to keep them in the fight, so we got to do what we can to promote that.
So in that worst case scenario, then people would be transported to Bismarck or Fargo?
Well, again, it's on us to make sure we're looking far enough out in the future that if we need to stand up a Tier 3 hospital and the northwestern part of the state, we will have a plan for that. If it needs to be in the southwest, we'll have a plan for that. The central part of the state, again, we want to ramp this up as needed based on the threat and make sure that it's there at the time it's needed.
One more question for you. Can you just clarify the difference between Tier 1 and Tier 2? Would Tier 2 hospitals be the same? Are those the same hospitals as Tier 1 but just expanded, or are those actually different facilities than Tier 1?
And this is why I rarely follow a script, because I don't read well. Tier 1 is the exact same hospital, but they may be licensed for more beds than they can currently staff. So there's some surge there. They may be surge then where they use space that they normally don't for patient care. And right now, we're working with corporate partners on this, but the hospitals are focused on building to that Tier 2 capability. And in some cases, they may not have enough PPE or equipment or personnel. And in the Unified Command and within the Department of Emergency Services, that's what we do. When you have a shortage or shortfall, we go try to find it. So we will work with them to fill those shortfalls. But the Tier 1 and 2, or the Tier 2 is primarily a hospital responsibility with support from the state of North Dakota.
I have a question. I was just going to say, do you think you have the capacity for ventilators at this point, or will there be a plan to try to get more ventilators in the state if you have to go to a Tier 3?
Again, the answer is yes. No. Yeah, I said earlier, 408. I've looked around at some other states. That's pretty good for a state our size. I've been told for ICU beds, we're in pretty good shape for a state our size. And again, we are working very aggressively with the Department of Commerce to make sure that we have the equipment we need up to and through that Tier 3 hospitalization plan.
Just to follow up on that, I had about 6 or 7 emails about this. Can CPAPs be used as an emergency ventilator?
I've been told that you can use a CPAP if someone needs help breathing. I would leave it to a doctor to go beyond that, but that's exactly what we're working on. What are all possible solutions to the problem? Because right now, if there was a ventilator available, 50 states, 4 territories, and the federal government would all put a purchase order in. So we're working very hard to generate options to save lives when the point of need presents itself.
I have a question about ventilators as well. In the past, there's been sort of a discrepancy in the definition between total ventilators and available ventilators. Are those the same in this context? Can all 408 be deployed for use on COVID-19 patients?
Okay, I'll take a stab at this. I think the answer is yes, but it's back to, as you work through Tier 1, Tier 2, where are those ventilators? What are hospitals doing with their internal policies to make sure that all available ventilators are in position for COVID if needed? I assume they're already stopping elective surgeries, or they have a ramp plan to make sure that as those ventilators are needed, that they will be there again at the point of need. Okay, thank you.
I'm just going to add a couple things on to that, on top of the great answers from General Dohrmann, but the 406 number that we're using, that's identified. The team that we're working on, we're trying, just like we have that line on the chart, trying to raise hospital capacity up, we're trying to raise staffing up, we're trying to raise PPE up, we're trying to raise ventilators up to get higher capacity, because we need all those things together. And that includes working, we're exploring through Department of Commerce with North Dakota manufacturers, shifting their capacity to build ventilators. There's work about how can you get one ventilator to serve 2 patients. There's the CPAP thing that Dave asked about. So we're trying to look at every possible way to expand that, because we want to get to the point where when the peak comes, that we are not at that point standing up here telling citizens in North Dakota that we came up short of either staffing, equipment, or beds. That's what the team is working on around the clock. How you can help all those people that are working around the clock is follow the guidance on helping to slow the spread. But if it comes, we're doing everything possible. And basically, as the general said, we're operating under the idea that no more ventilators will be showing up in North Dakota, because there's just everybody in the world, and if it's not the 50 states and the territories and the federal government, it's every other country in the world that hasn't been hit yet is also looking for them. This is a global market for medical equipment, so we'll have to apply our own ingenuity to try to expand that as far as we can. And then in terms of the expansion, I was on, Brent Sanford and I, Lieutenant Governor, were on a call earlier today with mayors from all of the larger cities in the state of North Dakota, and by larger, I think the sum of all those mayors equals more than 80% of the population. We're going to do a call with every mayor next week, but this was assembled on short notice. During that call, we learned from Jamestown that their hospital, which is one of the 36 critical access care that's licensed for 25, that they've got approval to go to 64. And so again, they're at the local level, we're doing the planning team working on that, but there are some great work being done at the facility level where people are working, in that case, to more than double their capacity in-house. That's all super helpful, so thank you. I got a question coming in from around the state. Danny, shout it out.
Cecile Wehrman with the Journal in Divide County. There's a concern that out-of-state residents working in the oil patch might not be included in North Dakota positive numbers because they're not residents. How is the state reporting positive tests for non-resident workers?
Mylynn, any advice on that? Question was if we had somebody who tests positive but submitted their address, like Texas, if it's an out-of-state oil worker, would we know about that?
It would go to Texas.
Answer is that would go to Texas right now.
But we would still notify that individual here.
We would notify the individual here, so we would have some awareness that that individual is here. But it would if they listed their address as Texas, it wouldn't show up on our numbers. So again, back to what I said before, we have to presume it's not about one individual. It's about, we have to assume that COVID is in every county and in every community, and we have to act appropriately. There's a lot of fixation on single tests coming back, but we have to assume there's 10 times more people out there than we know about, and the data's latent, those two things. So we have to assume it. And okay, and then also, if the person is here and they got their test done at a North Dakota facility and then we're notifying that individual, then the Department of Health and their contact tracings team will still be contacting people. So we're still taking action against that positive test here, but it doesn't show up in the data, the county by county data that we have. So we treat every positive the same way that is done. If the test is done in North Dakota, we treat it the same way. We contact the individual and we start identifying all the other people they've been in close contact with. Okay, Lane from KX. Sorry, Amy, I know you had your hand up, but go ahead, Lane.
Is public transit going to keep running the same as it always has, or is there going to be restrictions, or is it we going to shut it down entirely?
Question on public transportation still operating. This came up in the mayor's call today, and we heard from mayors and encouraged mayors to keep public transportation going. Many people, if you're using public transportation, likely means they don't have another means of transportation right now. And so that's an important, what we'd say, critical infrastructure for that portion of the population. We know that what cities are doing, they're taking precautions to protect their bus drivers. They're reporting that with businesses closed, ridership is down. So on the cities that have got the larger buses, people can still maintain distance. They're offering the disinfectant wipes if people want to wipe down their seats, hand sanitizer on the buses. They're doing a number of things to try to protect those individuals and the drivers, but we encourage them to keep it open, because if that were to close, we might be involving and exposing actually more people and giving those people rides, whether it's for food or medical care or other essential services. But we have to remember that not every North Dakotan owns a car. That's a hard concept for some people to understand, but we got to make sure that we're providing those services for those people that need them the most, doing it in the safest way we can. Okay.
So if the Department of Health notifies and does contact tracing for the people living here who are counting towards some other state's totals, how many cases are there like that?
Question was how many cases we might be doing. Do we? We'll look and see if we can provide that. Okay, we'll take a look at that and see if we can give you an answer coming up. One more from Danny coming in online.
Chris Larson with AM 1100 in Fargo. For the Governor Mylynn, what should people do if they know someone who has traveled but isn't following the isolation mandate?
Okay, you hear that one, Mylynn? You want to come up on that one? Question was, what do you do if you know someone who's traveled but they're not following the isolation mandate? And I'd say there's before and after today. Today was a much stronger order. So if they're still not following it after tomorrow, I'll let Mylynn answer what they should do.
So, as the governor said, a local law enforcement are the individuals that, and the state highway patrol, are the individuals that would help enforce this order. So we have heard of cases like this. We would ask that individuals that do fall in this category, that they understand the importance of this order and adhere to it.
Governor Burgum, there's a couple of cases now on Indian reservations in North Dakota. Chairman Fox yesterday spoke about one on Fort Berthold, and then there's one reported in Sioux County today. Can you just speak to what sort of communication the state is having with the various tribes across North Dakota?
Well, I would say we're in constant communication with the tribal leaders. I was on a call with all the tribal chairmen, their medical staffs, and a number of their council leaders just before coming here to this conference. Scott Davis, who is Executive Director of Indian Affairs for the state of North Dakota, he and I and Brent, we've all got cell phone numbers. All the chairmen were in constant contact with them. We're making tighter and stronger connections between their Department of Health and our Department of Health. They were there existing, but we're broadening those out. And the one of the topics of the call today, for example, in the case of the MHA, the Mandan, Hidatsa, Rickaroth, the three nations, three affiliated tribes, those in that case, then our Department of Health had already been in contact with them, and this is, again, as how it happens in real time last night. I'm getting Scott and I are getting calls and texts from the chairman. Mylynn's reaching out. I mean, so we're in real time in a position to respond. When we have a positive, everybody's on the same page, which is we've got to dial up the amount of contact tracing. So one of the action items from today's call with the tribal members is we're going to have a follow-up webinar between our Department of Health contact tracing team and all the folks that are working in public health at the tribal level to make sure that everybody understands the protocols and that that we're effective in doing that contact tracing. And this is in some cases the tribal teams contacting those folks who may have come in close contact with a positive. They'll expand our bandwidth, and they may have more access and more trust when people that they know are calling. And so again, we work in hand to try to at this point, when we've got that first case, to do a great job on contact tracing to try to do that. And then if we identify people who've been in close contact, then we want to make sure we're ramping up our testing so we can test those people. That's the way. And then, if somebody knows the individual who is been reported positive and some of that information is being released by families or others, we can't release it. But if you know someone, you know you're in contact with them, don't wait for the Department of Health to call. You can start self-isolating right now if you've been in contact.
And do you know where there are testing facilities like in Newtown or in Fort Yates on Indian reservations?
Again, in some cases, the testing may have happened in one of our major markets, but in other places, like in Newtown, where they got the Elbow Woods Clinic, testing is taking place there, or test collection is taking place there. I mean, we should assume that test collection is available at every medical facility in the state. I believe right now it is. And if it's not, and you're saying, well, it's not at ours, well, then call us and we'll work with you to make sure that we can do testing at the point of care across the state.
Question here kind of fits nicely into that. The Department of Health does contact tracing for all the positive cases, so presumably we know where all of these people are within the state. Why doesn't the department just report them based on where they're seeking treatment or where they're isolating rather than where their mailing address is?
That has to do with the personal health information law. So that's what we're offering right now, and that's what we're sticking to right now. This is has been brought up multiple times here. It's a challenge, but it also respects personal privacy. You can imagine during a pandemic if you're releasing, names and addresses of people that are presumed positive or positive, what that might do. And so we want to stay away from that because it's not about the ones that test positive. Like I said, there could be 10 or more out there that are already positive, but they haven't been tested or the date's lagging. So again, what we need to do is presume it's everywhere, act accordingly. And we, less fixation on the few cases we have, because that number is going to keep going. And at some point, New York, when you get into the tens of thousands of cases, then you're well beyond contact tracing becoming really effective because you don't have enough bodies to do the contact tracing, and then you're just making sure you got enough hospitals built. The importance of us doing that now and doing that where we're trying to balance between respecting individuals' rights to privacy and doing a great job at getting people to self-isolate. That's the balance we're trying to find right now.
Question coming offline about a healthcare worker in Moorhead, Minnesota, who had tested positive for coronavirus after being at an assisted living facility. Question is, will there be more testing done statewide on healthcare workers for either those who work in hospitals or on site? And maybe that's a better question for Mylynn.
I'm hoping everyone heard that question, but yeah, it was reported that there was a healthcare worker that tested positive that had been working at a long-term care facility or had visited a long-term care facility in Moorhead. And this is the scenario, again, that we're would like to eliminate completely, and you could if you had unlimited amounts of testing. We aren't there yet in terms of unlimited. I think we're going to see one of the new normals in our world 10, 12, 16 weeks from now. When you have a pandemic, there's going to be, people may be getting tested before they go back to work in a manufacturing facility, much less going back to work in a hospital. So there will be an explosion of more testing at lower cost, home tests. We're going to see a lot of action on that front. But among the criteria that Mylynn offered earlier, healthcare workers are among those who are priority for getting tests. And while we're in this position of having limited tests, if we have healthcare workers that are, if they're sick, they should be staying at home. If they feel if they've come in contact with someone that's positive, they should get tested. The healthcare, we have to protect those frontline healthcare workers. We got to protect the people in our facilities. So we want to really keep focusing on that. And as we continue to ramp up and focus on our team that's working on expanding testing capacity, one of the uses for that would be testing healthcare workers. There was a great announcement yesterday, but immediately when you have great announcement, there's a shortage. But Abbott announced yesterday that they had FDA approval of a device called ID Now, which is a current testing device that they have. We were in contact with Abbott. There's 22 of those inside the state. They need to be upgraded through a software upgrade, a USB jump drive upgrade, and then getting the test kits. So it'll take some time to make that to happen. But those tests on that the new Abbott upgrade, you can get a positive test in 5 minutes on that. On site, on point of care. It takes you 13 minutes. It chugs along. If it's negative, it takes 13 minutes. Only does one at a time. But this kind of technology, which they're racing to, they're converting all their existing and they're expanding their capacity of those devices. That's the kind of device that you might see in a healthcare facility where someone could rapidly, or an emergency worker could rapidly get tested to find out whether they can stay in the game or whether they got to sit on the bench for 14 days. But not 22 of those in the state. We know the locations they're at. We're in the process of notifying everybody. We're working with Abbott to get the upgrades, but no testing available yet on that front. One more from coming in from around the state.
April Baumgarten with the Forum in Fargo. Is old age itself considered an underlying condition, and are there circumstances where families may not be able to visit family members in the hospital at end of life?
Two-part question coming in from April Baumgartner from the Forum. The first part is elderly, I think was the question, or age, a criteria for testing. Right now, it's age plus symptoms. We're not testing people just because they're over age 65. We don't have enough testing equipment to do that. But if you're in that vulnerable group and you've got an age factor and you've got underlying health issues and you've got symptomatic, we absolutely positively want to be testing you. And if you're positive, we want to be tracking everybody you've been in contact with. The second one was a question about end of life. If someone was end of life, would there be restricted visitation? Mylynn, do you got some thoughts on that one?
Individual facility will decide.
Individual facilities would be deciding that in terms of their practices and protocols. And again, it would matter a lot, I'm sure, in terms of physical location, ability to isolate, and all that. But difficult times ahead on that regard, potentially, depending on, again, how much our peak is. Okay, we're near the hour. You may.
I'm getting a number of questions myself, people who are assuming that schools are going to reopen next week. Could you address that?
Question is, are schools reopening? No, as I said earlier today, school buildings for student access are closed indefinitely. Indefinitely doesn't mean, if you look up indefinitely, that doesn't mean forever. That means until we announce differently. And so until we announce differently, school buildings are closed for access for students. And we're looking forward to getting the distance learning up and running and going by April 1st. And I said some school districts may beat that date, but excited to have our kids learning again. But as you saw earlier at the beginning of the press conference, our numbers are still going up. we're going to have to be on the way down before we start thinking about changing access to schools.
I'd like to ask General Dohrmann. General Dohrmann, did you include in your analysis of university system buildings the possibility of using K-12 schools for the same purpose?
We really haven't looked at K-12 schools, and part of it is the life sustainment capability you need at each site. I know there are probably some schools with a robust cafeteria, but the physical plant, the dorm space, the food service, that was kind of the focus. And there's certain value in having simplicity in a plan in an emergency. So being able to work with the university system so we didn't have to negotiate with a bunch of different entities, I think made the plan simpler and easier to execute. And again, in a crisis, that's a good thing.
Yeah, and for the clarity for those now watching, universities are state-owned buildings, and we don't really have to ask a lot of permission to make that happen. School districts are independently managed by their own boards, so that is, and generally don't have dorm rooms, which can be used as isolation rooms for hospitals. So General's completely correct on that answer. Okay, we're at the end of our time here today. Again, want to close as we head into tomorrow. Tomorrow, for those that are here watching online, we'll make an announcement which we'll post on the ND Response and the governor's website by 11 o'clock tomorrow morning if we are indeed going to hold one of these tomorrow at 4 or not. We may just do press release update at 4 tomorrow, depending on what the news of the day is, but we may have one depending on how things are unfolding. For sure, we're going to be back on Monday at 4 and throughout all next week. But as we are in the weekend, we know that there are some faith groups who Saturday is their day of Sabbath. We know that for many others, the majority in our state, it's Sunday. But again, we want to give a shout out and thank all of those faith leaders around the state. We know that this will be the second Sunday where they're not having their congregations gather in person. There's a lot of innovation that's going on in terms of how they're delivering against their faith-based missions. But we want to thank all of those organizations for what they're doing. And on behalf of the First Lady and myself, I do want to offer a personal note. We do receive a lot of notes from people that are saying, hey, we're praying for you and everybody in the state that's working on this, and we want to acknowledge that, thank them for that, but also know that that we are praying for all the people in the state that are all the heroes on the front line, all the healthcare workers, law enforcement, first responders, parents, school teachers. I mean, everybody in our state's doing amazing work right now. And as we said at one of these very early conferences, if you're doing nothing more than staying at home, avoiding contact, following the hygiene rules, you're also a hero because your actions may helping be save lives. So we're in it together. Thank you all. And if we'll see you tomorrow if we've got a big news day. If we don't, we'll see you on Monday at 4 o'clock if we don't. Let's pray for a slow news day for North Dakota. Thank you all and have a great evening. Stay healthy.